Located within Huntsville City Schools is a medical clinic at Sunny Hereford. We also provide transportation for children needing dental services, for children attending Sunny Hereford and Morris, as well as children needing optometry services that attend Martin Luther King Jr. Elementary and Sunny Hereford. We also have a medical, dental, and optometry clinic at Madison Crossroads Elementary in Toney, Alabama. This clinic provides care to children within Madison County school systems. The medical clinic is also staffed with a pediatrician, nurse, clinical coordinator, and provides well child visits, sports physicals, hearing and vision screenings, sick visits, and many other services. The dental clinic is staffed with a dentist, 2 hygienists, dental assistant, and clinical coordinator. Our dental clinic is outfitted with 1 procedure room and 2 hygiene chairs. The dentist and hygienist provide comprehensive dental exams, screening every 6 months, fluoride treatments, sealants, restorative work, as well as other dental services. Thank you for trusting your child's care to us and allowing us to be part of the solution. Since
So just wanted to let you guys know how many visits we did over this past year. We had over 1,500 dental visits, almost 300 optometry visits, 2,600 medical visits, and we also provided over 2,000 dental screenings throughout Madison County. And all of that work is for free for all of the kids. And then just looking at the schools within the Madison County District, at Madison Crossroads, we had a little over 700 visits. And these numbers will be important as I get a little bit further down and we talk about Madison Crossroads a little bit more. On the dental side, we had 509 visits, and then for optometry, 71. And we also, which was not highlighted in the video because it was during COVID and we did not have it open when we produced this video, is we also have a dental clinic at Madison County Elementary in Gurley. And this past year, we saw a little over 100 kids out there. And just wanted to kind of highlight our providers. We do have 3 pediatricians that work with us and now 4 nurse practitioners that staff all of the practices for us. The services, just again, to reiterate what we do, is most importantly the well child checks, because all of the kids we see either have Medicaid or all kids are no insurance. And so we make sure that they're up to date on all their immunizations. We also provide acute care, so if a child is sick, we can see them for those visits. We do COVID testing, flu, strep, all of that we're able to do in the office for them. Provide lab work, so our nurses actually draw the blood and send it out so they don't have to make another visit to the lab. Of course, prescriptions, and then management of chronic diseases. We have a lot of kids that we see who do have asthma on the medical side. And then we have 2 dentists that work with us, Dr. Ahmad and Dr. Miller. And for dental, we are also like a regular dental office. We do all of their cleanings every 6 months, x-rays and fluoride treatments, sealings, and periodontal care. We're also able to do fillings, extractions, face maintainers, and all that kind of stuff in-house. And for optometry, we provide complete vision and eye examinations for the kids. And we also are able to fit them for their glasses. And surprisingly enough, about 60% of the kids that we end up seeing need glasses. So that turns out to be a pretty significant amount of kids that need glasses. Wanted to also let you guys know, we haven't made a huge announcement about this, but it will be coming over the next few months. But we are getting a mobile medical unit that will be able to do medical and dental services. We're hoping to have that completed by July and hopefully in operation sort of in July, so we can get all the kinks worked out and ready and up and fully operational when school starts in in August. And so we're kind of looking at where we're going to go with that. And so that's also a conversation for you guys to help me figure out from a perspective of the schools that we're not in, which ones have a higher incidence of kids that will qualify for our services, so we can help us target which schools we need to go to. And then also just other services we're able to help the kids with is on-site mental health. We do have a lot of kids that we prescribe their ADHD medications for. We do collaborate with Wellstone, so each school where we are has a counselor that we refer them to and actually sometimes share space with them. Crisis intervention, as well as we collaborate with NCAC and crisis services. And then oftentimes we had kids come in that do qualify for Medicaid, but they don't have it already, so we will work with the family to get them signed up for Medicaid or all kids as well. And then, one of our other really awesome programs that we do is called Heels for Heels, and sometimes this is what we're known for a lot, is we do give the kids a brand new pair of tennis shoes each year that they come to see us for the annual wellness visit. So we sort of use it as an incentive to get the child there, but we also see kids throughout the year that need them, especially in the other programs on dental and optometry. And so if we see a child in need, we don't make them wait and they get it. So each year we're given over 1,000 pair of new shoes throughout the organization. We also keep hygiene kits on hand too. And so we, especially when they come to see the dentist, they get a brand new toothbrush each time they come see us. And where do we get our funding from? So sort of depending on the year, but this is what it looked like last year. We are able to bill Medicaid for our services. So 28% of our funding came from what we were able to bill and collect from Medicaid. The other 42% comes from fundraising, and then the other 30% is made up with grants and just general donations that we receive. And so what we're very proud of is 92 cents of each dollar goes directly to patient care. So we're able to keep our costs low through our relationships with all the school systems, which allow us to be there, provide the space and some other services. So that is a huge help to us to be able to continue to do this. And then because of that, only $12 a month provides medical care to one child for an entire year. And then $20 a month also provides medical and dental care for a whole entire year for one child. And then specifically wanted to talk about our facility at Madison Crossroads. I don't know if you guys have been out there to see it. Would love to show you what it looks like. As you can see, the house on my left side is what houses medical and dental, and it is in very need of repair. It's extremely old, and it's sort of the same thing with the trailer for dental. You can see the trailer in the background. We sort of have the front is where we had to do the extension on, which is our waiting room. But we constantly have leaks and all kinds of other stuff that, we're just constantly, you can see. We've done some repair work to fix these things over the years. We've had a major leak that's done some damage to the floor. I think you can see it better here on this one. So what were some of our options that we were talking about is, I know that there's the proposal to do the new school on McKee Road. So obviously for us, we would love to be built into that new school, but we know that that might not be the best option that the school is able to do, but certainly want to put that one on the table. The other option is to have permission to put a modular unit on that campus so that we could go ahead and be incorporated into the site plan. And then a possible third that, I don't even know if this is even possible, but if any of the classes are going to be moving out of Madison Crossroads or Spartan Middle, is it an option to renovate some space within those schools? Because what is really great with us being located on the school campus is when the parents or the guardians fill out that enrollment paperwork, they can elect for us to go get that child from class and see them without them being there. And so that's what's great about being located on the campus. But this location is more centrally located to all of the schools that are located in that area. For us to do this and be able to accommodate all of our services, we're looking at about 2,800 square feet for it. And then I went ahead and pulled some of the demographics for the schools that are in that location that we serve, which is Madison Crossroads, Harvest, Spartan Middle, Spartan 9, Spartan High School, Monrovia Elementary, and Monrovia Middle. And for our demographics, we go by the poverty level, and those are students that qualify for free or reduced lunch. And looking at those, it's about 48% of all of those students within that area that qualify for our services. So it's a little over 33,000 students. And then what this would allow us to do is we would look at increasing our footprint for medical for sure, because right now we only have 2 exam rooms. So we're not able to run more than one provider at one time. So once we get the new space, we would be able to double those visits on the medical side, as well as dental, but also dental this next year. We are planning to add another day. So within this next school year, we will see an increase in those visits. And optometry just kind of falls in line with medical because we get a lot of referrals from our medical providers for that. So We're looking at total, once we get the new building in place and additional space and providers, that we would over almost double the number of visits that we're able to do for the school system. And then just one last video. Let you guys hear from our providers.
My name is Frances Graham,
My name is Kathy Nall.
and I'm a pediatrician.
I'm the lead nurse here at the Hills Pediatric Office.
I was taken aback when I realized, some of the basic needs that aren't being met for the kids that are in these Title I schools, that kids will come to school without food, without shoes, without underwear.
The reality is, without the Hills being present on site here at the schools, some of our children would be facing some very serious challenges.
They don't have the ability to have their medical, dental, or vision needs met.
You would have kids taking a long time and suffering with infections and other health problems that would create chronic problems. We're able to treat those problems early.
We had a child come in, new to the area, no insurance, in a lot of pain. Mother didn't speak English. The child had been sick for too long.
I was walking down the hall in the school one day and I saw a little girl in the hall. She said she wasn't feeling well. Well, let's go see the provider today because we have a provider in the office.
We could tell immediately that he needed to go to see surgery and he probably had appendicitis.
She had an ongoing strep infection, gingivitis, and two raging ear infections.
After his evaluation, he did have an appendicitis and it was just on the cusp of being ruptured.
She saw the dentist here and she saw the ENT specialist. He took her to surgery.
We were able to get him there in the nick of time. He had his appendix taken out.
We had to do several follow-ups before she could go and actually get the surgery.
That little fella could have died from appendicitis.
Potentially life-threatening illnesses.
By being available, we were able to get him the services that he needed at the time that he needed them.
Having that doctor available here, we can go get them from class and bring them here and then call the parents and tell them what we did for that day.
We were able to save his life.
We've seen the child since and the mom since, and they were very happy.
The HEALS organization makes a profound impact on the lives of the kids that we serve.
I believe that the delivery of the health care is equally important as the health care and the medical care that the patients receive as well.
I've learned one thing through a mission trip that I went on, was that oftentimes you can intervene early on. What could be a permanent disability is made right early on.
Our children would not have access to this type of health care without the Hills Clinic being here.
By being able to have the resources to keep these clinics open and to see these kids that don't have other options, we can intervene so that they can live normal, healthy, and productive lives and not have a permanent disability. It feels great knowing that I've been able to make an impact in a lot of kids' lives.
It just feels really good to know that I am making a difference around here. I feel connected to my families and to the children that we treat here at the Hills office. My purpose is to ensure that all of them
are less fortunate than I have been or that my kids have been,
are able to come to school happy and healthy.
complete their education.
A quiet and a gentle place where patients can come here and get the health care that they need.
Build the self-confidence and to be able to move on to the next level.
And to ensure that none of the kids here at the Hills offices or at one of our site schools is left behind.
Who knows how far these kids might go.
It feels special.
My name is Frances Graham.
My name is Kathy Nall, and I am the lead nurse,
And I'm a pediatrician with the HEALS organization.
and I am part of the solution.
And I'm part of the solution.
So what I'd like to ask of you guys is awareness is a huge thing for us, to be able to let the kids know that we're available for them. And so if you have different meetings that you would like for me or some of my staff members to go to, certainly able to go out into the community and let them know, because I think it's always a misnomer that, we can only see kids from Madison Crossroads or one of the other Huntsville City schools, but that's not true. I mean, if a kid qualifies for our services, which is at or below the poverty level, we're able to see them. And so we know that throughout the district, there's many kids that qualify for the services. They just don't know that we're here and available to see them. So have any ideas for that? And then certainly want to continue to grow the relationship, to let you guys know that we're here to help, and what other services that we can offer. Want to build on that partnership as we go forward. and see also what we can do about Madison Crossroads, and then if there are other school needs, certainly with the mobile unit, that we would be able to take that and fulfill some of those other needs too within the other schools. So, any questions?
I just want to say thank you. 'Cause, I mean, that's a big help. So I appreciate you.
Thank you very much.
Board, we are looking at the difficulty with the building as far as putting it inside, but we are looking, and Mr. Curzort is actually working with our architects right now, you know, on the McKee Road project, that we would have an area that would be laid out and developed for the purpose of putting a Heels Clinic on that campus somewhere, so that it's kind of being laid out where that infrastructure is already being laid out for where it could possibly go. So we are working with the Heels Clinic. We have a good relationship with them, and they do so many good things for our kids, and so we want to help out any way we can. So that is something that Mr. Curzort's working with the architects on.
This is our goal, to see more kids. Bring them on. We're ready. So, but thanks for your time today. I appreciate it.
Ms. Tracy, thank you. Our next informational item is the Pace Academy Community Service Agreement. Ms. Witt?
Good evening, everyone. I just wanted to take a few minutes to go over a new community service program that we're doing through our alternative school, Pace Academy. So the purpose of the program is to encourage and empower our students to become service-oriented adults who give back to their community. They can substitute service hours for up to 10 days in alternative school, which equals up to 30 clock hours, or 3 hours equals 1 day. The guidelines is they have to volunteer for a nonprofit, a hospital, retirement community, or food bank. They can submit a request that can be approved. There are some pre-approved organizations that we already use, but then they can also submit a request if there's something that's not on our list. The parameters is it has to be completed within 45 school days, which is a 9-week quarter. And but some, like if it's seniors, they have to actually complete it before graduation if they want to walk with their class. And if it's not completed by the deadline, then the student's required to finish the original number of days that they were given at PACE. To be eligible, not everyone who goes to alternative school is eligible. They have to have a minimal discipline history. We found that several students, especially here lately this year, have had 0 incidents before just making one mistake. And unfortunately, it was a big enough mistake to get them assigned to PACE. So we want to make sure that we're giving them an opportunity to learn from it, but also give back to their community. But some of the things that are not eligible, of course, are violence, weapons, harassment, and a previous PACE placement. They may or may not be eligible. Any questions?
So what's the definition of minimal discipline history?
Very little to none. It's all on we have to kind of look at the whole child, so it's all on an individual basis. We try to be as consistent as possible, but we look at, we have some kids who come to us who have never had a single office referral. They did one thing, and it landed them in alternative schools. So.
Can you give me an example of like a situation, obviously not a specific particular student, but that one incident brought them over to the alternative school?
Well, we have several. So maybe they had a vape that maybe had some THC in it, like a Delta Cloud 8, something like that. Those are against our code of conduct, and we'll get you 45-day placement in PACE. So something like that, they may be able to, may have not had any other incidents, but just something like that.
The whole purpose of this is to be redemptive in nature and give the children, we know that where the best place they're going to learn is in front of their teachers. So although Pace has qualified teachers, being in their classroom is the best place for them. So this gives them an opportunity to shorten the sentence at Pace for 10 days, and it gives them an opportunity to do some community service and get out in their community and do some good there in order to earn those days back at that rate of 3, for every 3 hours it's a day. So it gives them, just a way to shorten that, get them back in the classroom, shorten our staff, the number of students at the Pace School at any one time. And it gives them, a sense to get back to school quicker. And again, this isn't like they can't go, mow Uncle Mo's grass and get, a write-off from mom and dad. This has actually got to have a solid vetted out program where they're going to go, and that's why there's like food bank, hospitals, nursing homes, things like that, where they're going to actually go and do, and there's actually a full contract that they sign, as well as a place where the hours are documented by the people who are supervising from that agency that's working with the students.
And that full contract with all the details should be in the board documents from tonight's scrolling agenda.
Go ahead, go ahead.
Maybe in here and I missed it, but my understanding is we have children of all different ages at Pace at this point. Is there an age limit on who we can allow to do this contract?
Of course, like I said, everything, whole child has to be, that's why everything is considered on an individual basis, definitely. And most of the time, if it's a younger child, they don't give us as much time there anyway. We look at all of that when we're deciding how many days they get, so.
The grade is on the, they have to put the grade on that.
Yeah, I was just. No, good. Any more questions for Ms. Witt?
Thank you, Ms. Blair.
Thank you.
Executive session for safety.
All right, in this part of our work session, we added an item D, executive session to discuss school safety. So I need a motion to go into executive session for us. I got a motion in a second? All right, all those in favor? Madison County special session for Thursday, April the 6th is in session. Mr. Kubik, I'll let you continue.
Sir, I recommend approval of the agenda dated April 6, 2023.
Motion.
Have a motion and a second for the recommendation for the approval of the agenda dated April 6, 2023. Any discussion? All those in favor?
Aye.
Aye.
Sir, at this time, we have a request to address the board.
Yes, we do.
It's underneath you.
Yeah. Okay, is Ms. Lindsay Barron here? Okay. All right, so this looks like, based on the information I've been given, this requires an executive session to discuss.
Parent, student handbook, and student code of conduct as submitted.
Motion.
I have a motion and a second for the recommendation for approval of the 23-24 Parent Student Handbook and Student Code of Conduct as submitted. Any discussion?
I'd like to make sure everybody understands, this is a living document. In fact, Monday, Mr. Perkins' staff was making changes to it based upon input from teachers and principals. And I know that many people are watching. If you see something that we need to change next year, shoot an email to Mr. Perkins or his wonderful staff, Ms. Wood, and they'll put it on the do list to take a look at it. This is a living document that we have to abide by, but it's not a perfect document.
Okay. Thank you, Ms. Burke. Any further discussion? All those in favor?
Aye.
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 I recommend approval of the bids as submitted.
Motion.
A motion and a second for the recommendation for approval of bids as submitted. Any discussion? All those in favor?
Aye.
Aye.
I recommend approval of the contracts for service as submitted.
Motion.
Second.
Motion and a second for the recommendation for approval of contracts for services as submitted. Any discussion? All those in favor?
Aye.
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 Hey, let me say this. I appreciate the emails you send us now. How it's broken down is a whole lot easier to understand. So,
That was a great request. It was a lot
you can actually see where the money's going. I appreciate it.
I recommend approval of the personnel items and addendum as submitted.
Second.
Motion and second for the recommendation for approval of the personnel item and addendum as submitted. Any discussion? All those in favor?
Aye.
Aye.
I recommend approval of the probationary principal contract as submitted.
Motion.
Second.
I have a motion and second for the recommendation for approval of the probationary principal contract as submitted. Any discussion? All those in favor?
Aye.
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 Mr. Curry, I'd like at this time to recognize that Ms. Kimberly Britton is our new principal at Moores Mill Intermediate School, starting tomorrow morning.
If you're listening, Ms. Britton, but congratulations. We look forward to working with you.
I recommend approval of the supplemental contract and discontinued contracts as submitted.
Motion.
Second.
I have a motion and second for the recommendation for approval of supplemental contracts and discontinuance of contracts as submitted. Any discussion? All those in favor?
Aye.
Aye. All right, that concludes our special session
Are we finna go back in executive session again?
items.
Yes.
I need a motion to go back into
Second.
session.
Yeah, motion.
All right, motion